So thank you so much, everybody, for being a part of Mega Wellness Summit. It is whatever day, I have no idea. I know today is Thursday, and it's also St. Patrick's Day. So thank you. You're wearing green.
Yes.
I came to the show with no green. So I get pinched today, but my kids were off and running. They're enjoying it. And it's been a busy few days since the summit has started.
Yeah.
And so, I'm in a bit of a whirlwind. I'll say that. But it has been a joyous whirlwind, and I'm so grateful for everybody who is participating and sharing the summit with their friends and family. And I hope they continue to do that because we're going through April 2nd. Mm-hmm. I really don't know what I was thinking when I was like, let's make this a 3-week summit. But, it all works out. And I know that it's a bit of a slower pace than what people are used to for summits. People are typically used to having about 7 or 8 experts being just thrown at them. And this is more of a slower pace. It's more one-on-one with live shows. And so I wanted to make it very interactive. So without further ado, you are Dr. Chris Hengesteg. And, I have to just express my gratitude right here and right now, because it has been a blessing since I met you and your wife, Christine. And I'll just share that story with everybody. Last year, this is the most bizarre story ever, but again, it's so meant to be because I went to an SB 277 rally to try to get vaccines. Anyways, if you don't know what SB 277 is, we could talk about that later. I met his wife very briefly. She was so cute. She's holding her little baby and has her little 3-year-old at the time. And, I handed her my card and I was like, just call me. And we hadn't really spoken. I just blurted it out. And she was like, okay. And she did. And so I said, I don't know why I handed you my card. I really don't. But I just felt like it just needed to happen. I just went with it. And so we had some play dates and we went to church and we had lunch date. And so that was really cool. And so when I told Christine that I do summits, and she was like, we have to have Chris on. I was like, yeah. Of course. And so it wasn't up until recently that this goes into my story that I was going to tell, that I made that announcement on the email, that about 2 weeks ago, I think it was 2 weeks ago.
Yeah.
I had severe abdominal pain like I have never had it before. And it was so bad, I thought I was going to go to the emergency room. Now, anybody else in their right mind probably would have went to the hospital. And because I'm so hospital phobic and doctor phobic, I was like, and I don't mean doctor phobic, like as in natural. I don't mean naturopaths. I don't mean chiropractors. I mean the doctors who don't believe in what I believe in.
Right.
I'm afraid of. And I said, I don't want to go to the hospital. What do you think this is? What is it? And he goes, well, I don't know. You could have a bacteria. You could have all sorts of things. And I'm like, oh my gosh, I just want the pain to go away. I was so tired and fatigued. It was the worst pain. It was all over my stomach. And I had never experienced anything like that. Oh, hang on, we have some. Hold on. Let's see here. We have some newbies on. And let's see. We have Antonella. Antonella, are you there? I don't know if she can hear
Yes.
me. Hi, can you mute yourself?
Yes.
For whatever reason, it's not allowing me to. You rock. Thank you so much. Okay, so just back to it a little bit. So I had pain all over my stomach, and I just feeling like I really wanted to die. I was like literally crawling on the floor. I was doubled over in pain. I couldn't do anything for myself. My husband had to come home from work. My parents had to come over just in case I went to the hospital. I mean, I'm telling you, like, this was a to-do. And so Dr. Chris followed up with me. You cared so much about me and my well-being. And that's so different than a lot of my experiences with doctors. So I am so grateful. 2 days later, I came to you in your doctor's office, and we did some testing. And so what actually happened to me?
Yeah, well, first off, thank you for having me. And I know this, you're doing some awesome work with the Mega Wellness Summit. I've learned so much in the last week, and sometimes you think you know a lot, and then you talk to somebody like Dr. Stephanie about glyphosate, and that was just like, whoa, mind blowing, and so keep it up, be strong. This is so important for everybody. I mean, just listening the last week will change people's lives. It'll waken them up. So, first off, you're doing awesome. Thank you for having me. Such great people to be with. And getting back to what happened. Yeah, that was interesting. When we deal with digestive issues like that, what we're looking at, which was so crazy, is you hadn't had that before. That was something new. And, to be tumbled over in pain like that, the first thing, of course, you think was, was it the appendix or something crazy like that? But if you had those for years, I would have been like, well, that's possibly a Crohn's type of a issue, a Crohn's disease.
Mm-hmm.
But since it was so immediate, and with the fatigue and everything else going on, I knew right away that, I wanted to have hands-on. I wanted to see you as a patient, and I wanted to do what I do. I implement applied kinesiology or muscle testing with vials. And, what we found was, there was definitely two things occurring in the guts for whatever reason. It could have been a bug. It could have been a food poisoning. It could have been something that just brought you down. And we found two components, one being the candida, and another one, which I believe was really the case causing the big cramping or the pain, was the bacteria, And so I, immediately did my muscle testing, applied kinesiology, and found what would be able to help your body cancel out on that. So I gave you, I actually gave you three things. One was the antifungal or the anti-candida. Yes, I gave you the which is my absolute favorite for candida. And then I gave you an antibacterial that actually kills the bad stuff and doesn't harm the good. It's a natural herb. And then I gave you, of course, with the fatigue, you always got to look at, with what's going on, how much hard work you've been doing, and everything just kind of snowballed and it got exhausted, was, the adrenals.
Yeah.
Your adrenals immediately. If you don't address the adrenals, your body has a harder time healing. So really I wanted to look at your foundation, as I do with every patient, is kind of diving into what we do is usually, 95% of most issues, health issues, disease, and I want to throw this out now so we don't, it doesn't come up later, but, only 5% of most diseases have a genetic predisposition. So 95% of everything else can be correlated to a candida problem or fungus or yeast, parasites, microscopic parasites, We're not talking like that third world, like, you know, some people think parasites, they think the huge worms. We're talking microscopic parasites, bacteria, which we're all common to, virus, which we're common to. And then, you know, the big one now is the heavy metal toxicity. That's a huge one that I'm seeing a lot of now, especially in children. And then we have the chemicals and pesticides, kind of like the glyphosates and things, you know, from non-organic foods. And
Right.
then a big one is, you know, food sensitivities. You know, those right there are kind of the foundation of what triggers any type of health issue. So you came in and we checked all of those and addressed the adrenal glands with it. But, you know, we found the candida and the bacteria to be the primary reason of why you're experiencing such, you know, awful pains and discomfort.
Right. You know, I have never really experienced, I always kind of was in denial about candida with myself. My mother struggled for so many years with fibromyalgia, IBS, and candida. I mean, literally saw her struggle. And I'm like, nope, that's not me. And, you know, to an extent, we are different people, but I never saw the pain in myself as I did with her, you know? And so I know a lot of people are struggling with candida or struggling with IBS, and those things are going to look very differently from how they look from you or I. I think everybody has their own different way of looking at candida. What I mean by that is that your story is going to be different from mine. And so what other kind of symptoms would people experience? I've heard, you know, lots of vaginal discharge when there's candida present, which again is not my story. And I might not be the people who are listening right now. And I don't even know if that's even, is that common?
Yes.
You know, vaginal discharge, heavy vaginal discharge?
Yeah, when the candida problem, again, you know, it seems to tend to have like its priority, like intestinal IBS, things like that. And sometimes it can be very reoccurrent vaginally, you know, and if it's reoccurrent vaginally, you know, you constantly, I got another one, I have another infection, you know, it's a candida problem for sure. Other symptoms can be not just, you know, through irritable bowel syndrome or, you know, vaginal. You can just look at, you know, I don't feel good and I don't know why. I've been to the doctor. I've checked, you know, it's bacterial, no, it's viral, no. My body just does not feel well. I have aches all over. You know, another one is just cloudy thinking. You know, the brain just, I have such cloudy thinking, you know, and that's the candida affecting the nervous system.
I get the chilies.
Yeah.
I got them because that resonates with me. And I really hope that everybody just went, oh my aha moment right there, because we are not linking what you just said to candida.
Yeah. Yep. It's so common that, you know, the cloudy thinking affects the nervous system, you know, and I look at, again, approaching what systems. The nervous system is affected by candida. The muscular system, the joints, the bones in our body, you know, the chronic aches, the pains, I'm not sure what. The digestive system, the immune system, you know, you're always catching the cold, you're always getting the bacteria and virus or whatever that's going around. Well, why is that? The underlying factor actually could be candida. Your immune system, it's hard to fight candida once it's gotten through the intestinal lining. We call it leaky gut syndrome, and it's gotten systemic or throughout the entire body. Once it gets the body, you know, into the body, you know, it's a tough one to fight. But then your immune system should be here, but the candida brought it down to here. Now you're getting exposed to more the bacterial or the virus. You're wondering, why do I have chronic strep throats? Why is that reoccurring all the time? Why do I seem to always just, have issues? And it can get in the lungs. It can get in the respiratory system, which can trigger asthmatic-like problems and allergies. I mean, it is awful. It is the epidemic. It is awful stuff.
So we already have candida naturally. We're supposed to, right?
Yes.
But which is good. But when it gets out of balance, then it grows and grows and grows. Now tomorrow we also have Sariko Sternerhouse who puts a different spin on candida, which is she talks about candida as like a basil plant. And so basil's, typically a beautiful plant, but when it's surrounded by other plants, it can be contained. But when you let it grow and feed it feed it too much of what it loves, then it gets out of control and out of hand. And so that's what you're saying, is that candida overgrowth. And then when you put vaccines, I'm just going to say it right there.
Yeah.
Mercury. Okay.
Yeah.
Where we're getting these metals,
Mm-hmm.
toxic metals from everywhere now. I won't even just say it's just vaccines, because that's not the case anymore. But what happens when the heavy metals bind with candida?
Yeah, absolutely. Great question. The candida and the heavy metals we're looking at, the mercuries, thimerosols, and now, the big one is it's aluminum. Aluminum, they took all the bad, all that out to go, but let's just replace it with aluminum. Misery loves company, and, candida is misery, and heavy metals are the company, and they can join forces. They can bind together, and they can kind of, the heavy metals can bind with the candida, and then the candida can burrow into skin tissue. And that's why it can be so hard to clean up in the body. So what you got to try to do first, if you're looking at, you got heavy metal toxicity you have to always look at candida first. You got to wipe out the candida before you do anything with the heavy metal toxicities, because you want to try to kill as much of it as possible, which then if you kill the fungus, that can expose the heavy metal, which then you can take supplementation to excrete the heavy metals down the road, 3 to 6 to 8 weeks down the road. But yeah, they're a bad duo. They're not,
because it binds together, from what I understand. So right. Candida and the metal, they bind together and they hold together. So what I have learned in the past is that once you then clear out the candida, which might be happening to me right now, Dr. Chris, is that so if you have candida and if you have the heavy metal, so if you're killing off the candida that's going bye-bye, then you have the metals that are still hanging out.
Correct.
Which if those free radical metals are hanging out, wouldn't that affect my brain? And wouldn't that affect other people's brain function?
Yeah, absolutely.
Mental clarity?
Yeah, anytime you have any disruption of heavy metals, because we have to look at, number one, there's the leaky gut syndrome in our gut. And then the bigger one that we want to look at too is the blood-brain barrier in the brain. And, candida and heavy metals can cross that. So anytime you get into that blood-brain barrier situation, that can start causing a lot of disruptive issues, and they're going to, they're linking it, aluminum with Alzheimer's and things like that. It's coming around. It's coming around to look at that. But yeah, there's definitely something there. And I always bring up leaky gut syndrome, heal the gut, and then the blood-brain barrier. We got to make sure, we can, be able to detoxify the blood-brain barrier.
Yeah. I was talking to some ladies at my son's football game, and I was telling them what happened to me, and they go, "That happened to me too." And I had no idea how common this is.
Yes.
And so here I am, I'm sitting here, I'm 33 years old. I had that first experience of that pain. And then I had fibromyalgia pains. I don't know what else to call it,
Right.
but it was pains literally all over my body. I couldn't bend over. I couldn't do from let's just say how precious every single day is.
Yeah.
Because you never know when you're going to stop working. Like I can bend my fingers right now. I can bend over right now. But, you never know when those abilities are going to be taken away. And I saw myself, I felt like I was 75 years old. I couldn't do yoga. I couldn't bend over. I couldn't, I couldn't do the things that I'm typically doing. I'm functioning at. So, what happened with that, and how is that all linked?
Yeah. What happens is when, you got hit hard, it went from, hey, I was feeling good, and then boom. So usually what happens is people can already have issues going on like the candida, but it's not, they're not suffering from an irritable bowel syndrome. They're not suffering from recurrent vaginal yeast. They're not suffering from these things, but they might not feel good. But then, so your toxicity level is here. And then all of a sudden, I guarantee you what really triggered it was some type of a bacterial thing that comes into play, and boom, that cup overflows.
Right.
And then the body it shuts down. And inflammatory, cytokines and NF-kappa Bs and all these, scientific lingo that triggered all this inflammation, just caused everything in your body to just kind of tense up, and the joints were like, oh my gosh, what are we going to do? That's what you were feeling. You came into my office and you were pretty slow moving.
I know.
Yeah.
I know there are so many people out there, and probably those who are on the call today with us, that are in a lot of pain. And I can't speak to their pain, but they're obviously on the call because they have some digestive issues, which have probably led into a continual pain. And maybe even I could step into their shoes and kind of feel not on that kind of a level, but the fact that they can't really move, the fact that they're just really in bed with depression and because I mean, obviously you're not going to feel very happy. Yeah. And it all goes hand in hand.
And then you look at what are the primary, prescription drugs that are handed out mostly is cholesterol, blood pressure, and antidepressants.
Yeah.
Well, when I was, long story short, back probably, 14 years ago, how I got into clinical nutrition, I got really sick, and I never knew a thing about candida. I didn't know anything about parasites. I didn't know anything about, I knew bacteria, virus. I didn't know anything about heavy metal toxicity, chemicals and pesticides, and food sensitivities. I mean, that was all foreign language to me.
Right.
But I was a chiropractor. And, the one thing that I learned in chiropractic school that will always stick with me, well, there's a million things I learned, but, it's this innate intelligence inside of us that, we eat some healthy food, it distributes it where it needs to go without me going, hey, okay, I'm going to eat this food. Now I want you to go here. It's the body's innate intelligence, knowing what it needs to do to survive. And then having that going, wow, I went 2 years suffering. I had horrible digestive issues. I had horrible migraine headaches. I had severe chronic fatigue. I was aching all over the place, and I was still going through chiropractic college. And after 2 years, I lost about 40 unwanted pounds. So at one time for over 2 months, maybe 3 months, the only foods I could eat was white rice, green beans, and salmon. That's the only thing I ate for almost 3 months. I woke up, I had white rice for breakfast, came back for lunch, I had white rice and green beans, and then at dinner time I had white rice, green beans, and salmon. You know, when you cook salmon all the time in the apartment, it stunk like fish. You know, my roommate would attest to that at the time. But, you know, I couldn't do anything else because it triggered inflammation. It triggered the IBS. It even triggered the headaches. It triggered the fatigue. And
then the mercury in the salmon.
Yeah, right. You know, who knows what I was getting myself into. But, you know, I took the medical approach because I didn't know any better. And what happens was, I'm not feeling good, doc, and it was like, well, let's do a blood sample, and everything came out normal. You can have normal blood samples, and this is a really big thing to hit for everybody, because usually when you don't feel good, you go to the doctor, they'll do a blood sample. You can have normal levels of everything and still feel awful, you know, and still feel like, man, it doesn't make sense. And I had those, but I was still feeling, you know, completely wiped out. Well, then 3-4 months into it, you know, I had the tube down the throat, colonoscopy done. You know, I had it done because I'm like, something is wrong. Something is wrong. And they didn't find anything because, they're looking for the bad stuff, polyps, cancer, whatever it is. And I remember like a week later that nobody had called and said, hey, what's going on? But I did call them and asked, and the doctor said, it just looks like there's inflammation going on there. And I'll never forget that. So what is causing that inflammation?
Right.
So, you know, the candida can bury into the lining of the intestinal tract and not be so obvious to see, with what things are going on. But after 2 years, you know, I was ready to give up. I had lost about 40 unwanted pounds. I looked awful. I was, lethargic, and I was this close from ruining, dropping out of my dream of being a chiropractor. And thankfully, a colleague of mine said, I had the drop-off slip signed. I was going to quit school, and I was heading home, and I told my dad, I'm going to sleep on the couch until we figure this out. Like, it was that bad, and nothing had changed. And thankfully, a buddy of mine, a colleague, one of my best friends, he's based out of Kalamazoo, Michigan. Give a shout out to Dr. Osterhout, Vitality Healthcare. He's the one that was already dabbing into this.
Yeah.
That said, hey, we're going to figure this out. And within a few months, we found out, all primary causes of dis-ease or issues stem from candida problems, parasite problems, uncontrolled bacteria, uncontrolled virus, heavy metal toxicities, chemicals, pesticides, and the food sensitivities.
Right.
So we went right into that. And, I didn't thankfully have the pains or discomforts, but I was sick. I was a toxic, unhealthy person. I wasn't sick with the flu. I was toxic.
Right.
That's the best way to describe it.
Right. And so what did you do to help yourself?
Exactly what I did with you. We found a doctor that actually, he's out of Grand Junction, and he based his foundation on what I've said, implementing vials for muscle testing and finding what we can call the antidote, or what will cancel it out. So what was for me is I had everything. I had every one of them, but my body could only start detoxing certain things from the start. And a lot of it, you got to heal the gut first. We've heard a lot about that.
Right.
I started with the candida, and I started with the parasites. And I used that same supplement, the one that I had given you. And then with the parasites, I have other things. But, immediately I could start feeling, how you felt when you were getting better, the energy coming alive again?
Yeah.
That's your innate intelligence. That's what we're supposed to be, is that energy. But it was blocked by all of these things. Once I started getting rid of all these things, I came back to life.
Wow.
I started feeling so much better. And each week I was feeling a little better. Months went on. I started detoxing this, introducing adrenal gland, adrenal fatigue, immune system with the thymus gland. A lot of my systems were just shut down big time.
Mm-hmm.
So that's kind of the short story of everything.
Where do we get parasites from?
Yeah, parasites can easily come from, just a simple salad bar at a restaurant. They can come from just fruits and vegetables from the store. They can come from meats. They can come from fish. The biggest one I would say is probably the number one cause of parasites is probably sushi. The raw fish. That's a big one. That's usually somebody's like, man, I don't know what's going on. I'm like, have you eaten sushi lately? And 90% of the time they're like, yes, I just, but I could eat it before. Well, you probably had some tainted fish, and that is a big one for parasites. But it can be anywhere. And if your stomach is properly functioning with the right hydrochloric acid, your enzymes are functioning properly, it can kill the parasites in the stomach with the hydrochloric acid. But a lot of people that don't have the right amount of hydrochloric acid, because the right amount of hydrochloric acid is a great thing. It's an awesome defense mechanism. It's also what breaks down foods, and it's what breaks down the minerals enough to get into our body. It's essential. So if we're lacking the digestive enzymes and the hydrochloric acid in the stomach, then it can be just a sitting ground for parasites to survive.
But we won't know that. What are some indications that we have low hydrochloric acid?
If you eat food and it feels like it just sits in there like a rock, and you could be belchy, you feel like it could, hiccupy after you eat. That's kind of the biggest one. Is like, man, I eat and it just feels like it sits there way too long, and I get belchy. That's a huge sign that your body's not breaking the food down, for sure.
What about GERD?
GERD, yeah. That's a tough one because, you really need to go to a specialist to see is it actually there? Is there an acid reflux occurring? Is there too much acid occurring? But a lot of times heartburn and things like that can stem from lack of hydrochloric acid and digestive enzymes.
Right.
So always good. I'll say, like, when I see patients and they have, like, oh, I have GERD, I want to make sure they've been diagnosed from it properly, that they do have too much acid occurring in their body, and then we sit there and say, well, what is going on? Why is the acid, so heavy? It could be from candida problems. It could be from something, like it could be a candida problem, and the body's trying to produce more hydrochloric acid to get rid of it.
Right.
So yeah, it's really tough. And that's, with you, I always kept asking, where do you feel the pain? Is it in your stomach? Because, you said it felt like an ulcer, and if you have an ulcer, that's, you want to go to a specialist to, try to get something going there. And that could be an H. pylori problem. But it's hard to work with someone with an ulcer, giving them, even natural supplements like what I give you, because it could possibly agitate an ulcer. So, you got to be really careful. That's why it's so important. You don't just go, oh, I think I have candida, and you go buy stuff and it's like, oh, it's burning in my stomach so bad, and I was told that I could take this.
Yeah, well, so it's really good to go and see a professional. Now, I definitely understand that, because last year I did help my adrenals on my own with taking some good supplements, but I would say that I haven't had this much energy, and I would say my clarity is not very good. Yeah. I would really honestly say that. But the energy level is back. Especially with doing a summit, this massive for 3 weeks.
Huge.
It's definitely, and last year when I did Mega Wellness Summit, it just drained the adrenals. I mean, it was really terrible, and I experienced some depression, and it was bad. But this stuff that you've given me, let me give it.
Yeah.
So the chiropractor's blend adrenal, this seems to be so much better than the stuff that I got.
Absolutely.
Over the counter.
Correct. And that's why, again, I'm an applied kinesiologist or a muscle tester. I don't give anything unless I muscle test it to somebody, or I know for sure that they're going to be able to take that. And the adrenal one, you can go to the store and give that a whirl. But again, getting rid of the candida and getting rid of the bacteria allows your body's adrenal glands to function 100 times better. Does that make sense?
Mm-hmm.
If I just gave you the adrenal stuff and you still had the bacterial problem and the candida, your body would still be like, hey, you got to get rid of this garbage in me or it's not going to function.
Yeah.
So those systems working together, that's what's so important. The big ones is, again, the digestive, the immune, and the endocrine. Those are huge. And then we can check into more detail, like if that's cleared with you, there's supplementation, a huge thing. It's called the HP axis. And that is the hypothalamus, pituitary connection with the adrenal glands. And that's supplementation specifically for this, because humans, the biggest thing I try to teach people, and we're going to go into this more detail next week, so everybody jump on when we talk about the mental, emotional, spiritual aspect of it. It's not what happens to you because life happens, it's how we respond. And learning how to respond to everything, learning how to not be stressed out about certain things is a huge change in your overall health and well-being. But for you, this is a huge summit. You got some of the greatest talks specialists out there that are in here and connecting and getting everybody together and trying to get it all figured out. I mean, it's going to cause stress, no doubt.
Yeah.
But I know that once it minimizes, we can check things out. We can check out the full endocrine system with the adrenals and the pituitary hypothalamus connection. The HP axis is what it's called. It's very powerful stuff.
Okay. I love that. Let's talk about fungus for a second.
Yes.
Where in the world would you get fungus from?
Yeah, well, fungus, it's kind of I really put candida and yeast and fungus in the same category.
Okay.
So, it's really pretty much almost the exact same thing. It can be confusing. I remember reading about it going, well, is it a yeast or is it a fungus? Well, candida is a yeast/fungus. And again, that's already in us. So I'll go back to probably what is the primary causes of why the fungus, yeast, or the candida becomes so dominant in our body or prevalent. I would say the biggest problem is you look at, the 1980s, 90s, antibiotics for everything. It wiped out all our good bacteria in our gut, and the good bacteria controls that candida, yeast, fungus, so it doesn't grow. But when that good bacteria is wiped out, that immediately causes the yeast to just spread like wildfire. It's taking over now. There's no controlling it. So a big thing with that is, number one, if you crave sugar, because sugar is its primary food source. So if anybody out there is constantly craving sugar, you got the candida, fungus, yeast problem. So you look at, what do we have as a kid? Oh, I have a sore throat. Well, we're not sure if it's bacteria, virus. Here's antibiotics. And a big one, I had to be on this because, when you're going in high school and you're going through the puberty and you start getting a little acne, that's a complexion it's the only thing that matters. I was on, that's what happens. I was on tetracycline, which is an antibiotic, for 2 years straight. 2 years, every day, taking this antibiotic. So fast forward 10 years, do you think my guts finally gave out, literally?
Right.
Because I didn't know better to replace it with, eat yogurt. Well, I had a dairy sensitivity my whole life that I didn't know about, which caused the chronic recurrent ear infections. That's, again, another talk. But, antibiotics were just huge in the 80s and 90s, and now they're just sitting there going, hey, they're not working. You could probably put 3 decades that antibiotics were prescribed so much and wiped out, everybody's problem. I would say that is probably the number one thing. And then the second one I would say, especially in females, is anything dealing with birth control pills, because that disrupts your hormone functions, which then hormones have a huge part in, how well your body can function, period. So you can just look at like, wow, how many problems are out there and how many people are on, antibiotics or birth control pill or some type of hormone, type of therapy.
Right.
And that can contribute big time
Right.
to candida, fungus, or, again, candida is the fungus and the yeast. They're kind of all in the same category. You can knock them out with the same thing, but definitely a contribution.
Also, too, for those people who have been on lithium or antidepressants, this will also grow being on those medications, correct?
Absolutely.
Yeah.
Absolutely. Just any type of, you can look at almost any type of medication that you're on for, whatever reason is going to disrupt some normal function in our body to try to make the symptom minimize. But that allows, because prescription drugs, not just antibiotics, prescription drugs, they can wipe out the good bacteria in your gut also. Completely. It kills it, and that's huge. How many people are on some form of prescription drug? I mean, vast majority of the population, and those can also kill the good stuff that's in our body.
And lower stomach acid.
Oh, absolutely. Then it starts that, the lower stomach acidity and everything else, and, which can make you more susceptible to other things. Absolutely.
Yeah.
I know.
We have, the problem is that we have now a huge issue with two different worlds. We have one world that we're supposed to go to for help, that we cover up the symptoms and never get to the cause, which causes more illness, which is why you're a customer for life.
Right.
Keep covering every single symptom with more and more medications and therapies that cost a lot of money.
Absolutely.
The other world is the world we live in, where we live in. This is why I didn't want to go to the hospital.
Yeah.
The conventional way of medicine. Now, I'm not saying all medicine is bad. I really am not. But the way that you looked at it, right, was, okay, it could be an ulcer, but let's test your body and see how it responds. Okay. So no medical doctor out there is going to do that. He might have, I went to the hospital. If I would have went to the hospital, I would have probably gone home with some sort of antibiotic. I'm positive of that.
Thank you for joining the Pain Free and Strong Summit. I'm your host, Dr. Tina Moore.
Sorry about that. I'm your host, Tina Moore. Well, I'm your host, Nikki Jencen.
There we go.
Thank you for joining Mega Wellness Summit.
That's right.
And so this other world is revolved around looking at the whole person. And instead of just masking, the symptoms, is really getting to the cause of it. Yep. And so, bravo to you as being a doctor and just this person of change in this world that we really want to encourage people to look at your whole self, because yes, as a child, we've been to the doctor, we got our vaccines, we got our antibiotics as a kid, probably a ton of antibiotics, not to mention the pesticides in the food, glyphosate and coming up whenever they started that.
Yes.
The chemtrails in the air that contain aluminum, barium, and strontium. Those things were kind of like at a war with our health. And I don't want to say that with, I say that with compassion, and I don't say that to put fear into people, but I say, it's time to look at yourself as a whole being and get to the truth of what's really happening inside your body. And so how can people, and I know that people are really sick out there. I know that they are. And so the years of damage, the lies, and I say that with compassion in my heart, the lies that they have been told about pharmaceutical drugs, going to the doctor and understanding what's wrong with them, the damage that has been done over the years. You know, what do you say to somebody who needs the help, who wants to get better? They can't get out of bed, and it's been like this for years. Where do you even start?
Yeah, I always look at patients kind of as an intensity scale. Like, it's how long have they had it? How, what are the major symptoms? The longer they've been out, down and out, the longer it's going to take to get them reversed out of it. Yeah. But I go back to that, what I learned in chiropractic college was, again, that what chiropractor D.D. Palmer called it innate intelligence, is that thriving, that energy force in us that is wanting to be healthy, wanting to be healed, constantly, wanting to, get rid of toxins or, heal. Like those people that are really, really sick, that hope is still in them. They have the healing capability that's still in them. It just might not be as quick as they would want, but again, their body is wanting to be healed. It just needs the right things. It needs that right foundation. It needs, the proper nutrition. They could be sitting there, real sick and going, I'm taking my multivitamins, I'm taking my fish oils, I'm taking my calcium, I'm taking my this, I'm taking my that. Well, have you ever, kind of thought about getting rid of the foundational components to causing disease in the body and start going, hey, have you done anything with candida? Have you even heard of it? Or the yeast fungus, the parasites, the heavy metal toxicity? How about the adrenal glands?
Right.
The thymus gland. Again, the thymus gland is completely ignored because they say it stops really functioning at the age of 15 or it shrinks. The thymus gland is our immune gland, and that's a huge one that I also look at with the immune system, and look at those components and, what are your symptoms? Is it digestive? Is it an endocrine based? Is it an immune based? Is it, muscular? And again, going back to, that foundation and going, hey, this is the place where we need to start. We need to start, and it can be simple. I've had patients that were so sick, they come in and I only could give them one thing, one supplement. That's it. Else their body was so, I could say almost destroyed by the chronic unknowing of what was going on. They'd had it for decades. And, it's like, all right, here's one little tablet of yeast killer that I need you to take for 6 to 8 weeks. That's it. Or else their body, there's die-off reactions with candida yeast fungus. There's, bacterial die-offs and parasite die-offs and things like that. It's called the Herxheimer reaction. Layman's terms, it's a die-off. So when you're killing the yeast in the body, it produces actually a little microtoxin also. So you can imagine like how serious you have to take it when we're dealing with health issues. And that's why the severity or the intensity of each patient is so important to know. How well are they going to be able to detox this? I knew you were healthy. I was ready to go. Let's boom, take this, and this. And within, I knew you were going to be okay. But if you had did that for 20 some years, I mean, could you imagine? And that's like Crohn's patients. They have pains in their guts like that big time. You just don't go, here it is. You have to monitor and start slow and, just make sure that you're doing it just the right pace.
Right.
That's what's so important. But
Right.
everybody still has that healing capability. You know, if you have a little cut on your finger, it will heal on its own. We don't tell it to. That
Right.
innate intelligence that's in us, that universal health law, I kind of call it, is your body wants to heal. You know, all our organs regenerate itself. I mean, I think like Deepak Chopra has said, like the liver, you have a completely new liver within 3 months. You know, you have completely new skin within, there's everything in our body is regenerating. And
Right.
it's amazing.
Right.
Our bodies have been taken for granted.
Yeah.
That's a huge thing. Our bodies are a temple. And, we have 95% of the time, we have every control, like Dr. Bruce Lipton with the biology of belief. He's a huge discoverer of saying, hey, it's just not a genetic thing. It's what do you give that, what do you give your body, and our body will react to it.
Right.
Whether it's healthy or it's unhealthy or maybe neutral.
Right. Thank you for that. And I can't wait till next week when we have our, what is it called? Emotional technique release.
Yes. Yeah. We're going to get into some powerful stuff that, it changed my life and it helps change other people's lives, and really knowing like how powerful our mind, our emotions have an effect on our overall health also.
Yes.
Sometimes
our emotions are so important because we constantly push our emotions down, whatever it is. And so the emotions, what I learned from you and from other practitioners is that, the emotions get stuck into the subconscious in our cells or whatever, and they cause havoc years later.
Absolutely. It will just completely, it literally can destroy, physically, our mental, emotional body can start to destroy our physical body, because we all know, like, oh, stress, like, oh, I feel it in the neck, I feel it in the shoulders. But how long is that getting buried? How long are you putting it under? You're not dealing with it properly, and next thing you know, you have complete adrenal blowout.
Right.
You have all these other issues that your body, can't recover from, because it is an emotional based issue. Migraine headaches is a big one where you can look at, like, there's a strong emotional component with that.
Oh, so interesting.
Address that structurally, but also go, hey, what's going on? Did you, it gets pretty intense. It gets pretty deep. People, we don't know.
What emotion is that typically linked to?
It really can be a multiple of them.
Uh-huh.
A lot of it can be, it's kind of the negative, like the angers and resentments, things like that. That's a big one. And it's usually with people close to their family or whatever it is. There's things that, they just don't get the conflicts sorted out correctly, and it can manifest into, pain, migraines, things like that.
Right.
So yeah, it'll be a great another conversation.
Yeah. Yeah, it really has opened my eyes on so many levels. I mean, when I talked to you the last time, it was like, well, I was having some respiratory problems, and right there, it's like despair. And you knocked it out of the ballpark, and the symptoms went away for a long time. And I would say that that the respiratory is back a bit, and I would again say that it's there with the really the wanting of whatever it is, the future that I was going through. It was interesting. So I hope people tune in next week. There'll be plenty of opportunity, but I want to give a chance for people to ask you questions. So if you guys can go to manage participants, go ahead and raise your hand, and then you can ask Dr. Chris a question. If anybody has any questions, I will unmute you once you raise your hand. Going once. Or you could put your question in the chat box. Put your question here. There we go. All right. Anybody? Well, we will continue talking until somebody raises their hand because, you know, I know that this is an important conversation for people because it's still not 100%. Oh, here we go.
Great.
So we have, can't understand how to raise my hand. Margaret, I will go ahead and unmute you.
You hear me?
Okay, Margaret. Hello, hello.
Hi, my name's not Margaret. I don't know why the Zoom thing said that. I'm Peggy.
Oh,
Well,
that is bizarre.
I'm not Christine, so that's my wife.
I am Nikki Jencen, though.
Yes.
Great.
What is your name?
My name's Peggy.
Hi, Peggy.
Okay.
What's your question?
I came into this meeting partway through, so I may have missed my answer already, but probably not. I have Hashimoto's and HPA axis disorder, and I see a chiropractor regularly, and I go to my naturopath, and I have been eating the GAPS protocol for it'll be 5 years this summer. And I just did a course of rifaximin for SIBO. And now I'm less able to digest things than ever before. Mm-hmm. I have to take 5 grams of HCl and enzymes with every meal, and still have undigested food in my stools. And I'm stuck, and all of my health practitioners are kind of just, they're starting over again. They're trying things we've already tried before that I know aren't going to work, and I don't know where to go next with my journey.
Yeah, absolutely. You know, Hashimoto's that is a tricky one. I mean, I say that right away with any patient who says they have Hashimoto's. You know, that is a huge trickster of an autoimmune disease. It's a very hard one. And that, you know, thankfully the gal that spoke in the Mega Wellness, hopefully you've you know, I think it's Thyroid Loving Care.
Yeah,
Mm-hmm.
Jen Whitman.
Yeah, you know,
I've
doing
been
everything
for a couple of years.
Yeah, doing everything with that. Have you done, you know, like a candida cleanse and all that stuff?
Yeah, my nutritionist has had me on several different like courses of Allison and different Candida Clear 4 and a bunch of different things, and I don't eat any sugar or grain.
Yep. Have your adrenal glands been addressed?
Yeah, I took adrenal cortex for quite a long time, and then I switched to ashwagandha and rhodiola. Mm-hmm. And then I recently have stopped taking most of my supplements because depending when I take capsules and tablets, they just come straight through me. I'm not digesting them at all. So it's kind of just, I was wasting my money on supplements, so I stopped. And I probably should be taking the ashwagandha tincture that I had, but I haven't been lately.
Okay. Yeah, so with Hashimoto, we want to address, we've got to look at the adrenal glands, of course, going through the candida. And I can't, I don't know if some of the candida supplements you take were more of just like more of an herb, or was there type of an oil involved? Because sometimes you take a candida herb, it really just addresses the candida in your gut, because the body really doesn't like the herbs to get systemic into the bloodstreams and things like that sometimes. So it's good for wiping out the gut, but if you have it still throughout the body, that's where it's it's so important. Like, my favorite, have you been on the formula SF722 from Thorne Research at all?
No.
Yeah, that's my favorite one because it can do both.
That's the one I'm on.
Yes, correct.
SF721?
Formula SF722.
22.
It's undecylonic acid. It's actually derived from castor bean oil, but I love it because it kills the yeast, the candida in the gut, in the small intestine, large intestine, but it also can go through the small intestine and get absorbed into the body tissue and break down any candida that's in organ tissues, the livers, the thyroid, and things like that. So that's something to look into. But with your digestive system, are you just on the hydrochloric acid? Are you taking any digestive enzymes too?
I'm taking the Trienza.
Okay.
Yeah.
And it's still just not breaking stuff down?
No.
Okay.
Yeah, sometimes if I only eat broth and meat, I have regular stools. If I eat anything fiber, it is, you see it.
Does fiber increase or does it slow down for you?
Fiber makes my digestion go haywire.
Okay.
And I'm usually constipated, but then also mixed with diarrhea sometimes. So
yeah, the typical IBS type symptom that can come with the Hashimoto's. It's one where it's so hard because it sounds like, again, you've been on a lot of this stuff that, like what we're talking about, but not getting the results. And that's where it's so hard to, when somebody's done that, and it's like you're questioning, like, I thought this would work, I thought I would feel better.
Yeah, and I do feel better sometimes, and I do feel better than I did before I was diagnosed.
Mm-hmm.
But then I just haven't been able to get past. There's something stopping my gut from being able to heal, and my nutritionist thinks that it's heavy metals. But every time we try a homeopathic metals cleanse, it's way too harsh. It's too much. Just the tiniest. Just one drop of the homeopathic that she had me on was making my teeth feel like they were going to fall out, and my mouth tastes like metal, and crazy responses.
Wow.
Yeah, and again, that's kind of where I love the. Have you been down? Did they do any of the applied kinesiology or muscle testing?
I did Vega testing for all my food allergies, but I don't think I've done anything else.
Yeah, and that's again, there's so many great practitioners out there that they know what they're talking about. They help so many people, and for me, I went through an experience. Again, I didn't have Hashimoto's, but I went those 2 years that I was really sick. I was just going to some person, someone recommended. They said, "Here, try this. Here, take this. Here, do that." And I had this, my cabinet was full. My kitchen cabinet, I took all the plates and glasses out and just put all the supplements that I tried.
Mm-hmm.
So, finding a supplement that actually tests strong for you is going to be so important to try to get over what this is doing, to your digestive system. And again, that foundation, maybe the candida thing, maybe you do need that SF722. Maybe you need something more, than that's not a homeopathic, but also something that I love. It's called Takasumi Supreme, which is actually a bamboo herb which binds to the heavy metals. So, if you haven't gotten rid of the candida properly, again, those heavy metals could still be in there. They could still be in that digestive tract, those type of things. And again, addressing those adrenal glands, you got to do them all at the same time. It's hard to do just one, because if your adrenals are, out of haywire, that automatically can, shut your digestion down. Your body could be in complete even though you're usually, if you're feeling lethargic and fatigued, sometimes your adrenals can be on a high burn where it shuts down your intestinal tract to function properly. So, that's what I'm, really feeling for you is finding muscle testing, the right candida killer, the right heavy metal detoxifier, and the right adrenal type of, they work symbiotically to make it even better and not just doing one at a time. That would be a good start to that program.
Yeah.
And
so
doing a digestive enzyme that, at the same time too. But yeah, it's really testing exactly what your body needs, muscle testing, what makes you feel stronger, and what your foundation needs.
Right.
Does that help you?
I don't know. I just keep trying.
I know.
So,
where are you located?
Things. I'm in British Columbia.
Okay, so quite far from San Diego.
Yeah.
Dr. Chris is in Poway in San Diego.
Yeah.
Where his office is located. But you can talk to her over the phone, Dr. Chris?
Yeah, just real quick is I would definitely look for, because again, Hashimoto's it's a tough one, but look for somebody in your area that is certified in applied kinesiology.
Okay.
And completely understands the importance of muscle testing, exactly what fits for your body. Okay. That is so important because, I do consults and things, over the phone or talking with people over the phone and feel good. I would love to say I would love to be able to be right there, but you're definitely the patient that I would want hands-on. Mm-hmm. I could recommend and go, oh, here, I'll send this to you and you try this because you've done so much. But Hashimoto's, again, is very hard to work with, but it's workable. But look for somebody with applied kinesiology certification, okay. And, ask the doctor, your job is not your job, but, it's okay for people to call in and ask. I get people calling in and say, how do you do? What do you do? Do you do this? Do you do this? And they should be fine to answer those questions. That's our job. We're teachers. That's what the doctor is. Right. So finding this right person, and I know there's got to be somebody up there that does that and really can start a good foundation for you.
Right. Thanks.
Yeah, you bet.
All right. Take care. Thanks so much for coming on the call.
Yeah.
Okay. If there's anybody else who has a question, we have a few more minutes to take one more caller. Anybody else? If you're not exactly sure how to raise your hand, just go ahead and in the chat box, just say, I have a question. Whatever your question is, just write it in and I'll unmute you. All right. Okay, so we have one. Let's see here. And I heard that removing the filling in, okay, so we have a couple coming in. I heard that removing the fillings in my teeth may be riskier. Is that true? This is from Antonella. I apologize if that's not actually your real name.
Yeah.
Great question.
Oh, absolutely. I have a patient now that went through it, but you absolutely have to look around and talk to people, and you want to get those removed. You definitely want to try to get those removed, but you have to have it done by they have to be like certified professional, like that's what they do. Because, it is risky, for sure. It's risky, and you want to make sure that if you're going to get it done, that they have a supplement protocol that goes with it. And that supplement protocol is going to be to help your body detoxify any form of heavy metals that could possibly get into your body through, possible swallowing, through the salivary ducts, through anything else that can occur. But when done right and done professionally and done by specialists, it is a very, very wise thing to have done. But, they should have those, the two major things. Make sure they've done it before and they're professionals at it, and that's what they do. And number two, make sure that they have a protocol system that deals with heavy metal toxicity or heavy metal toxicity detoxification. It can't just be vitamin C. You got to have alpha lipoic acid in there as one of the big ones that helps out. So really look for, the alpha lipoic acid as a helper in detoxifying that heavy metals for sure. But yeah, it's more popular, and it's definitely kind of one of those things. I believe like the mercury fillings and stuff will be kind of the new LASIK surgery. Like there's LASIK popping up everywhere. I think the mercury filling thing is going to be a big one, but you got to be careful to make sure that they've done it.
Yeah, good question.
Yeah,
okay,
great
the
question.
Next question is from Diane.
Okay.
Again, I apologize if that's not really your name. How do you actually test the muscles? So how do you muscle test?
Yeah, muscle testing. So it's a simple concept of where you find a strong muscle, and it can be any muscle. It can be the deltoid muscle where you hold your arm up. I usually have the patient lying down, and I'll find 2 or 3 muscles that I like to check. This, pushing down, and the body. So long story short, it is, if you never had it done, it can be very confusing. It's kind of like once you have it done, it's like, wow, that's so cool. It's very hard to explain, but it really taps into quantum physics, really going into that realm. But your body can tell you specifically, is this healthy for me, or is it not healthy for me, or is it neutral? It's not doing anything. So anytime you can just simply, your body knows, see, mentally we think we have to ingest something for the body to know what it is. But, subconsciously our body knows our surroundings. And that's where it can get very confusing with people, because our body knows, like, I know I'm sitting in a chair, but our body knows what it is. Like our auras, our energies, fields will know exactly what's coming close to us. And the easiest way to kind of describe it is, if you've ever gone into this room or somewhere and you just had that bad feeling, like it's kind of like your body's telling you, hey, this isn't right, that type of thing. So muscle testing, we can simply just, I have the patient lying there, we find a strong muscle, we have them hold it. I like to go over the thymus gland here, our immune gland, and immediately we can get a response to it. Now there's ways, it takes practice, but people can self-muscle test. If you've ever heard people kind of do the ring, or they can do the finger, or they do that type of thing, but it takes practice. I've been doing muscle testing for 15 years, every day. I had muscle testing done to me back in 1993 when I had mono really bad. So that was a long time ago, and I was like, what in the world is this? But it was just simply muscle testing something. I had monovirus for almost a year, and I couldn't get over it. And she said, here you go. And I held it, and it was strong, and I took it. And ever since then, I was like, it works. It works. Wow. I got the certification in it. And that's why it's always, it is 100% part of my practice. So I don't know if it's meant for her to test yourself. I kind of rambled on there. I'm sorry. I love muscle testing. So,
well, I think the point of it is to definitely go to see somebody who is certified in muscle, who knows, certified or a kinesiologist.
Yes, correct.
What they're doing.
Absolutely.
Okay,
Yep.
Another one from Antonella. Is systemic candida a real diagnosis?
Oh, well, absolutely. You have to put it as a diagnosis, because the candida can get through the leaky gut. Is there some type of code the medical doctors use? I don't know. But that doesn't mean it doesn't exist. But systemic candida, Absolutely. Absolutely is a diagnosis of some sort that you can, go. It's in all sorts of tissues in the body. It's not just in the gut.
And let me just say really quick, and then we're going to have to wrap this up, is that doctors love to put names on things.
Yes.
And so, what is caused by inflammation could be diabetes or, it's just putting a name on it.
Yep.
And so it's really it's more simple how the body works than what we think, I feel, in some cases. And so we've been indoctrinated into putting names on what's going on in the body. And that's a way of keeping tabs on things, which I understand. But at the same time, diagnosis is just another word for, another term that whoever made up.
Absolutely. And, when patients come to me, I tell them, I'm not treating your, whatever it's labeled, I'm treating you.
Yeah.
I'm treating your body, and your body's telling me, hey, these things are going on. And it's nice to say, yeah, I've been diagnosed with irritable bowel syndrome for 6 years. Okay. So that gives me a clue to zone in on. But to me, I'm just like, that's caused from candida. It's caused from parasites. That's the thing. So I really just, make sure, hey, I'm just treating your body. Your body's telling me. I'm not treating your disease. I'm just treating your body that's in a dis-ease state,
right.
Not normally functioning. So we're going to just try to get your body functioning better.
Well, Dr. H is back on Thursday, next Thursday, the 24th. We're talking about releasing the emotions that are attached to illness and how you feel. And so emotional release techniques. So, one more question. Or she says, thank you both for a wonderful call. It has been a breath of fresh air listening. Thank you so much for being on the call, and thank you for that wonderful compliment. I appreciate that so much. So I appreciate everybody taking the time to be on the call today and listening, and you had wonderful, wonderful questions. We have live calls like this throughout the summit. Again, the summit ends on April 2nd, so hopefully you can tune in and get any of your questions answered live. All right. Thank you so much, Dr. H. You're amazing. Thank you. I know you have to go on with your day, so thank you so much.
No, thank you, Nikki.
And don't worry, I will have links for everybody to click on so they can easily access and call you and contact you, okay?
Awesome. Thank you.
All right. Thank you.
Bye.
Bye-bye.